Hi everyone, my name is Cassidy Schindler. I'm a fifth-year kinesiology student at the University of Regina. I had the opportunity to complete my fieldwork at the Regina Community Clinic. The Regina Community Clinic is a primary health service provider. They are a multidisciplinary group of health professionals that work together with the ultimate goal to build a healthy population by offering support that concentrates on diagnosis, treatment, disease prevention, and patient education. Under the supervision of a certified exercise therapist, I had the opportunity to lead initial and follow-up consultations with patients, create and adapt exercise programs, assist patients through their exercise programs, and teach online group exercise classes. As a future healthcare professional, by having these opportunities, I was able to gain confidence in my abilities to work with a diverse population. For my special project, I compiled information with the intentions of bringing increased awareness to the topic of pregnancy and exercise. The Canadian guidelines recommend women without contraindications should engage in prenatal physical activity, but few women meet the recommendations. This is due to uncertainty among some pregnant women and obstetric care providers as to whether prenatal physical activity may increase the risk of congenital maladies, which has served as barriers to being physically active throughout pregnancy. One of my learning objectives throughout the semester was to further my understanding in exercise prescription and the overall goal of the individual client. In focusing on a specific population, I was put in a position to conduct research, in which I was able to translate into understanding exercise prescription and goal development for before, during, and after pregnancy. The first phase of my special project was to conduct research. I additionally completed a CSEPT professional development course on pregnancy and exercise to further my understanding of this topic. Next, I put together a presentation that was delivered over a lunch and learn to the clinic staff. Additionally, I reached out to the University of Alberta's Dr. Davenport, as she specializes in the topic, and she sent me a few posters to hang around the clinic. I also created a brochure for the doctors to reference back to and give out to the patients. Using the knowledge I obtained throughout all my research, I compiled a pregnancy and exercise document that highlights specific areas of exercise in pregnancy. This document can be used by my supervisor in the future for a reference. Additionally, I developed a few Instagram posts for the clinic's page and contributed to a psychologist pregnancy blog for further exposure on this topic. Overall, I would consider my special project successful. I initially developed this project to develop my understanding on exercise prescription and goal development, but I came to realize that there was a lack of understanding about the benefits of physical activity before, during, and after pregnancy. I hope that my work has helped to bring more awareness around the subject, which will benefit the health of the patients at the Regina Community Clinic and beyond.